We're back here with our spinal decompression chair. Hey, Oakland County, this is Dr. Jamie Cramer, chiropractor here at Precise Chiropractic. And I have one of my patients, Tim, with me today, who originally came into our office with complaints of lower back pain and sciatica. He described not only the radiating shooting pain every day, but it was also radiating in his lower back, going down into his glute and into his leg. It was not only preventing him from sitting and standing for long periods of time, but he wasn't even able to tie his shoe without stabbing pain. So today we're gonna walk through exactly how we treat these issues in our office with our lower back restoration protocol, combining targeted NUCCA chiropractic adjustments and non-surgical spinal decompression. It's the same protocol we used here on Tim, not only to get him out of pain, but actually he's able to finish his workouts at the gym again. So we'll walk through exactly what we did for Tim. So Tim, we're gonna go ahead and first do our amazing targeted NUCCA chiropractic adjustment. And we always start off these specific adjustments with a specific measurement. So I'm gonna have you come on over here, Tim, and we're gonna actually measure his posture. So what we're gonna do is we're gonna be measuring his posture. Your posture is the window to the framework of your spine. So what I'm doing here is we're actually three-dimensional people. And so we are measuring your spine in 3 dimensions. You can come right out of there. We're actually measuring the hip height, and his hip is off 1 degree today. He's twisted back in his hip an additional 1 degree. And up here where I used this laser, his neck is off 1 degree. So that's indicating that he's out of alignment and he needs an adjustment today to allow his brain and his body to talk and feel and work his best. So now we're gonna give him one of those amazing NUCCA adjustments. So the adjustment that you're gonna see is gonna have no twisting, cracking, or popping involved. It's extremely gentle. It's about as much pressure as taking someone's pulse. Do you feel much, Tim?
Not much.
And it's very, very impactful, very, very powerful. And this is a whole body adjustment. So what that means is there's a small bone at your top of your neck called your atlas. It's actually a free floating bone. We learn exactly how to use that bone to take pressure off your brainstem and allow the entire spine to relax and get your body into alignment. The simplest ways I can describe this right here is a telephone pole that's gone off in the wind. This is the head, this is the lower back. What we're doing is we're going targeted from the top, adjusting this area till it goes back into alignment to take all that pressure off of that lower back. And we do that every single day. So the adjustment you are seeing is actually a whole body adjustment delivered at the top of your neck. Extremely powerful and extremely effective. Okay, so we're gonna get Tim adjusted here today. And we're gonna have you turn your head all the way to the right. Very good, and all the way to the left. We're gonna just do a little more adjusting. And it's about as much pressure as taking somebody's pulse. So very, very gentle. Okay, come on up from there. And you can go ahead and turn your head to the right. That's much better, and all the way to the left. Now what we're gonna do is we're gonna measure Tim's posture and make sure he's fully back into alignment. So before we adjust anybody, we measure them before and we measure them after. So we are precisely knowing that we are totally taking care of you in the best way possible, that everything is perfectly into alignment. And it is. His hips are level, there's no twist in his hip, and his head's on straight. They're all set. So he is what we call chiropractically perfect. The next step in his healing journey is we're gonna go back and do your spinal decompression. We're back here with our spinal decompression chair that we have. Our spinal decompression is a non-invasive spinal decompression that actually is used for chronic pain, improves mobility, and promotes healing. It actually creates a negative compression into the disc space. So it increases blood exchange, it actually helps with nutrient exchange, and it also takes pressure off the disc. For bulging disc, herniated disc, lower back pain, sciatica, spinal stenosis, any type of sharp pain or weakness in that lower back. And this is the same protocol we used on Tim. So we're gonna show you how this works today. So Tim, you can go ahead and lay back there. We're gonna just go ahead and put these underneath his armpits. We're gonna give him a nice little pillow there, and then he's just gonna hold on to these. Our sessions are 12 minutes, and they are very, very relaxing, and they feel really good. So what we're gonna have Tim do is we're just gonna have you bring your legs closer in there, and you can just relax. We're just gonna put this right like that. And what's gonna happen is you'll experience several cycles of stretch and relaxation, which gradually peaks over a period of several minutes, and it works. So this is really, really wonderful. And we're also going to add in for him, and to help speed up repair and recovery into his disc area and into his lower back, is we are gonna add in some heat and vibration as well. It's a very soothing, comfortable experience for anybody that feels this way. Adding in the heat right now, and now I'm adding in a little bit of vibration. And you can see he looks very relaxed, looks very happy. And what this is doing is it's pulling, and then it will decompress. And that's how it creates that negative pressure into the disc to help it repair and heal, feel really good. And this will do that. And then we'll also sweep side to side. And we can do that for targeted areas for sciatica issues or any type of thing that you may have on a MRI. You don't have to have an MRI, But when you have an MRI, we can have all these settings to target that specific area to help that area that is injured be its best area for healing and recovery. So he gets 12 minutes on this chair and he does a series of these that helps with his lower back pain, sciatica, and helps him recover very fast. So if you're dealing with lower back pain, sciatica, and that dull, constant ache that radiates sensations that goes down into your legs, and you're ready to finally address the root cause, we'd love to invite you in. For a limited time only, our entire new patient process, which includes our exam, our one-on-one consultation, x-rays, and EMG scans, are over $200 off. All you have to do is click the link below and claim your voucher on the following page. Simply request a convenient time for you, and one of our team members will call to confirm that. We have a limited number of slots per week, so be sure not to put yourself off. See you on the inside.